I'm the athletic trainer here at Northview High School. The majority of injuries that take place, the most common would have to be probably an ankle sprain. And that would be where an individual either steps on somebody's foot, finds a hole in the ground, something that common, and then rolls their ankle outward. That would be a sprained ankle. There are stretches and there are strengthening exercises that can improve the ankle's ability to handle an injury that might take place, but it's not an absolute that you'll never get a sprained ankle. Obviously, it helps to reduce the injury if you get it, because you'll heal faster if you're in better shape.
Lieberman joining us here. And doctor, whether you're a weekend warrior or you're a professional, everyone is susceptible to knee injuries. But I always hear the terms like MCL, ACL, and then now you hear also talk about cartilage. First, in layman's terms, tell me what cartilage is and what purpose does it serve?
All right, that's a great question. So cartilage is the tissue at the end of bones, and it's really what makes up the joint. It's hard tissue, and it's a tissue that allows you to have pain-free range of motion of your joint.
What can you do to prevent an injury in that area? I mean, like I said, everyone is susceptible to knee injuries, whether you're a weekend warrior or you're a guy getting out there pounding the court like some of the guys inside.
Well, there are a number of things that you can help yourself as you, particularly as you get older. First,
that's what we need, right?
Right. That's particularly what I need. What you need to do is always stretch. Before you play, you should have an exercise program where you're building up your quadriceps and hamstring muscles, and after you're done, you should ice. And the other thing we don't like to talk about, but we tell patients they should lose weight, because that's really important on reducing the pounding on the knees.
Yeah, certainly the impact on the joints. Okay, now say you do, in fact, pick up some sort of knee injury and you're diagnosed with maybe a tear in the cartilage. What's the process like to get yourself back out on the court, back out on the field?
Right, so there are a number of things that we can do to help patients. First, they can take anti-inflammatory medications. We can prescribe physical therapy and a home exercise program, and that's what we start out with. If that's not effective, then you have to start getting to other agents like anti-inflammatory medications or nutraceuticals, which are chondroprotective agents, chondroitin sulfate or glucosamine. If those things don't work, then we step it up into the joint itself, and so it could be a cortisone injection, or lately people have been using platelet-rich plasma, and there's some interest now in stem cell therapies or stem cell injections into the knee joint to try to stop the inflammation. That's the key thing. All these steps are done to reduce the inflammation in the knee so you can go back to playing.
Sounds like a little bit of prevention before you get those injuries will go a long way in toward making sure you don't receive an injury like that, but also probably help you in your recuperation.
Absolutely.
All right, Doctor, we appreciate you stopping by here on Clippers Live. Again, that's Dr. Jay Lieberman from Keck Medicine of USC.